He was later operated on to remove the osteosequestrum. It was a granuloma that contained the sequestrum, but a little fistula remained right here. And this is 2 years later. If we go back, we'll see that we were in 2003, and this is 2005. That is to say that for 2 years he had this fistula that would not heal. The introduction of silica at 2CH monodose closed it in 2 weeks. This is a cystic hygroma in a 1-year-old little girl. It's a hygroma, cystic hygroma, of about 4 centimeters. After having had chickenpox at 2 years, she often had a tonsillitis of streptococcus. This is the size of the lesion 4 years after, which is more or less the same, but you can see that you have these 3 lymph nodes and the thickening of the lymphangioma. After the umpteenth tonsillary inflammation, once the antibiotic therapy had been terminated, there was an acute phlegosis, like a large ball of 8 centimeters here on the neck. She was hospitalized, antibiotics intravenously, and 10 days later she was discharged. After 4 months, the hygroma was 4 centimeters, and she had another streptococcus tonsillitis. So I invited the parents to use this echinacea composita myosotis, which is very good for tonsillitis, in order to prevent the tonsillitis. So waiting for the surgeons at Bergamo to operate on this lymphangioma. So what happened, surprisingly, that there were no more tonsillitis and the lymphangioma disappeared in 4 months. These are the residual lymph nodes. The lymphangioma is no longer there. This is a few months later, and you can see the total disappearance of the lymphangioma without any scarring in 2 small lymph nodes. Now, the child has grown. She has never had any relapse of lymphangioma. The 3rd letter. Dear Doctor, on the 14th of October 2005, advised by Dr. Rossi, I came to see you with my son. I came for advice regarding the problems of scleroderma ulcers of which my wife suffered. I have the pleasure of telling you that a therapy with 3 baths a day with a solution of 6% of cytosodine has been very successful. The ulcers, both the one that remained after the amputation of the second toe of the left foot, which was not scarring, and of the other 2 neighboring toes that had generated themselves spontaneously have now scarred, and the ulcer in her finger has also improved. I must tell you that in the meantime, there has been a Pseudomonas aeruginosus diagnosed to her. This was totally cured in the month of October with an antibiotic of new generation after the antibiogram and the strong anemia that I had pointed out to you, less than 8 of hemoglobin. Well, this was totally healed in the course of the months of October, November, and December, with the abolition of anti-inflammatory drugs and the administration of iron. I must say that treatment with cytosodine has had effectively positive effects. The house care assistants have also started to use the same cure for very severe decubitus ulcers, and are telling me that the results have been surprisingly positive. I am enclosing photographs of the foot and the finger before and after treatment. I will send you other details if you wish. In the meantime, I would like to thank you from the bottom of my heart, and I would like to speak to you about her basic disease, which is causing a polyneuritis that prevents her from having a decent level of mobility. This patient has had this phlegosis for 5 months from a Pseudomonas disease. When she was visited on the 20th of October October, she had come to the end of her targeted antibiotic therapy. What is surprising in this case is that this woman had had followed her treatment very well, but she has a sclerodermia. You see, you have to have a re-epithelialization of a necrosis such as this, and the results are quite surprising. And the only therapy, the only treatment was water and citrusodine, which was quite a surprise to me too. And we are now thinking this over very carefully because it's a very interesting molecule. Chronic lesions, 91 patients having chronic lesions due to previous radiotherapy. I'm going to show you some rather crude pictures just to show you what kind of patients that we see. 40. This is a chronic ulceration. This type of ulceration does not heal. And patients take this with them to their grave. Sometimes it deepens in the tissue and reaches the lung level. The surgeon usually removes it, but the evolution that you see is not the rule. This is perfectly scarred. The stimuli of the scarring have been bathing with water and citrusodine, leaving the lesion open as much as possible, and a drug called Tulia and magnetic fields up until the 4th of July. We decided to stop because the patient had to leave the city, and we started with electromagnetic fields in October. I have seen similar cases operated on by surgeons which did not have any scarring in the end. This is a terrible lesion, sarcoma of the leg, which has been irradiated with the loss of matter, which is very important. When she arrived, she was phlogistic, covered by compressive gauzes. And we realized that it is more important to have local oxygen. If we put gauze on this and oxygen doesn't pass through, we will have a deep infection in 3 days, whereas if it's deterged and cleansed and oxygen can reach the lesion, it is fairly well, it remains fairly clean. The association of the drugs that we saw earlier on, plus a number of drugs that promote vascularization, and the magnetic fields have put the patient in the conditions whereby she could have a skin transplant, which was very successful. This is a dramatic patient with a phlogosis, a radiomyosarcoma at the femur. He was treated with chemotherapy, surgery, and had these important phlogistic lesions, 37.5 degrees constantly, very agitated, with these very clear signs of infection underway, which were perfectly healed in the course of a couple of months. But especially what changed was his life, because these injuries that have this bad smell do not have a bad smell with citrusodine in a very short time. Well, there you are. What are the future prospects for the treatment of severe open wounds with major tissue loss? Well, the transplant of brain stem cells, we'll see in the future. And now I would like to close with a letter that I myself wrote to Professor Silvio Garattini from the Institute Mario Negri. It was later published, and it is the sign of my pain towards these patients and the difficulty of being able to treat them, and if we are not given the means to do so.